Hi, everyone, and welcome back to Know Your Data, the Data Literacy Project series where we help you make sense of all the data, charts, and terms that we see every day about coronavirus. I'm Kevin Hannigan, the Chief Learning Officer of Click, and as always, our co-host is Alan Schwartz, a former Pulitzer Prize-nominated reporter for the New York Times and fellow data guy. Today, we're going to talk about something we're hearing more and more about, contact tracing. How does that program generate the data that goes into decisions that are incredibly important? As the Dean of Rutgers School of Public Health put it, contact tracing is one of the few tools that we actually have in the absence of a vaccine. So as we explore this, I'm also happy to say that we have a very special guest who Alan will introduce in a moment. Alan, why don't you get us started?
Well, thanks, Kevin. I think that we're starting to see a lot more headlines that talk about contact tracing. Here's one: how contact tracers help manage the spread of COVID-19. New York enlists army of contact tracers to beat coronavirus. And my favorite, so you want to be a coronavirus contact tracer? Now, tracing is not quite a hardcore data term like the ones we've discussed in this series, like flattening the curve or R. Instead of looking into the future, it's looking backward. When one person is found to have the coronavirus, we need to go back, see who they might have transmitted it to in the past several days, and try to get those people isolated before they spread it themselves. It's so important to do this that where I'm sitting now in New York City, we still haven't reopened at all because there aren't enough contact tracers yet. Now, as far as reopening goes, what does that mean in the numbers? Well, instead of 90% of people staying home, whether we think they have the virus or not, kind of blanket social distancing, we're now letting everyone come into contact with higher numbers of people. They're walking around and we're rolling the dice more on possibly transmitting the virus, which, all things being equal, gets more people infected overall. So if you're going to roll the dice more, make the possibility of snake eyes less. This can have a great effect on the rate of transmission, R, and help us influence and then interpret the data that we see moving forward. Now, that's by far the most important part of contact tracing, but it can be more than just working on individual cases. Patterns can form in a community or state over a month or so, and if we pan back on all this growing information, it might be possible for the little pixels from contact tracing to form a larger, at least fuzzy, picture of how the virus is spreading more generally as society reopens. Now, to help us answer all these questions, we are bringing in a special guest, Chantilly Jagannath, the founder of Millennials and Data, the Vice President of Data Visualization for Lovelytics, and of course, a member of the Data Literacy Project Advisory Board. Chantilly, take it away.
Thanks, Alan. Good to be here. Now, before we get to the actual data, I just want to say how contact tracing works. When a person tests positive, contact tracers ask who they've had meaningful contact with over the past several days. Because during that time, the person was almost certainly infectious but didn't know it yet. When I say meaningful, in a math sense, that means that they've had enough contact that there's a high probability the virus was transmitted. We can't contact every single person they breeze past on the street corner, obviously. You want to focus on the people they were with in the same room or maybe picnic with, things like that. Let's look at this in action and watch what happens. Alan, sorry, but you're about to get the coronavirus.
What? Oh, all right. Thanks a lot. I guess anything for the cause of data literacy. Go ahead.
All righty. So let's say our friend Alan gets tested and finds out on Wednesday that he has the virus. Because he's a good citizen, he immediately isolates himself so he doesn't risk infecting other people. But he might have already infected other people. For the last 3 or more days, his personal incubation period, he could have passed the virus on to other people and they not know it yet. We want to find those people and first get them tested and isolated too. This can have huge effects on the data. So let's watch what happened in action. Alan tells the contact tracer that he had meaningful contact with 8 people. Laura, Teddy, and Mark yesterday, Matt, Susie, and Kelly on Monday, and Bonnie and Clyde on Sunday. We contact those people and they offer to get tested. Uh-oh, 3 of them test positive: Mark, Matt, and Bonnie. So now we can immediately isolate those 3 people. We want to keep them from infecting other people. Now, let's watch what might have happened without this isolation. Had Mark, Matt, and Bonnie kept walking around, Bonnie would have infected 1 person on Thursday, and Mark might have infected someone on Friday. But now they don't. Those nameless people disappear. Success. Contact tracing from Alan couldn't help Mark, Matt, and Bonnie because it was too late. But now we've kept 2 more people from getting it. But maybe we can do more. We know that Mark, Matt, and Bonnie also had their own connections since getting it from Alan, but not knowing it yet. Hopefully it's not many, but let's investigate if we can. Matt tells us the people that he had contact with. We test them, and lo and behold, he passed it along on Wednesday to his friend Lizzie. And Bonnie, we test her contacts and we discover she passed it along to her friend Samantha. Lizzie and Samantha didn't know, and now they can isolate 2, stop running around, and maybe infecting 1 or 2 other people. Every person you find helps you keep these trees from growing. If you look at this, we've already saved 4 people from getting infected, just from contact tracing Alan and a few of his contacts. Now, I have to tell you that all of these numbers aren't this high in real life, but you get the idea.
Right. So Alan already infected his 3 people, but tracing his contacts kept those 3 people from then infecting 4 more people. So we've decreased those 3 people's individual R numbers, their own little personal Rs, and maybe a few more also down the line. We want to do this as much as possible so that those individual R decreases can combine to help decrease the big, let's say, state or countrywide R that everyone's looking at. Now, if we look at this, R before the reopening was 0.8. So for each 100 people with the virus, they infect 80 more. Reopening was going to make the R 0.9. But now that we're contact tracing, that makes it 0.7 instead. So you see the difference in total cases over the next several weeks. Here's how a contact tracer in Colorado actually put it. The number of contacts is likely to increase now that people are interacting outside their homes more. We're not expecting to get to 0 cases and stomp out a virus, but we do expect it at this low level we expect it to be at this low level, and that's where we're wanting to keep it. Now, question for you, Chantilly, getting back to our example, when Alan tests positive on that Wednesday, and we test the 8 people he had meaningful contact with, we don't just isolate only the 3 positives Alan infected, right? From what I understand, we also asked the other 5 people to isolate too, just in case.
Correct, Kevin. The reason we also asked the other 5 people to isolate is because there's about a 20% chance that someone can test false negative. This was the case with Teddy. Teddy wouldn't have known until his symptoms appeared on Sunday. So isolating him from Wednesday through Sunday keeps him from infecting Noah on Friday and Paul on Saturday. So now, instead of contact tracing Alan avoiding 4 more infections, it's now 6. Even better.
Well, I have to thank you for informing me that I had the coronavirus, Chantilly, because look at all the damage I would have done. So listen, that's how contact tracing works. But as we assembled this episode, I was really interested in what happens to all this data once it's collected. Can all these individual stories tell a larger one? So I talked with a few experts and I learned some fascinating things that I haven't seen mentioned in many media reports. First, I had assumed that when a person, and I guess it was me in your example, tests positive and the contact tracing begins, part of the goal was to see who infected me, not for revenge, maybe, but to keep that person from infecting others, right? But that's actually not what happens in contact tracing. And why? Because as one of my experts put it, quote, by the time we figure out who infected you, they're symptomatic and isolated and have already done their damage, it's too late. So I thought that was really interesting. You're not trying to frighten the person who infected me. And then, as I said earlier, you can still take all this individual data, put it together, and see if you can sniff out some patterns or trends. Did people in week 1 of contact tracing infect 2 people on average, but in week 4, a new batch of people are infecting 4 on average? Now, is this happening because these people are not social distancing properly or wearing masks? Do a disproportionate number of their transmissions appear to be coming from the same shopping mall, suggesting that, maybe that mall is not being disinfected properly? These patterns are extremely hard to detect, my expert said, but it can be valuable. And I thought that was really fascinating as we move forward in the reopening.
Thanks, Alan. So as usual, we'll cover our 3 takeaways. First one being process. So the type of contact tracing we're discussing is designed to find people who might have been infected, not the people who are doing the infecting. With many states and countries starting to reopen, we know that the R number will go up. Tracing helps determine who had contact with an infected person already, so we can isolate them as soon as possible and try to keep that R value down as much as possible. And finally, another use of tracing, although not the most important as it relates to this pandemic, is looking for any patterns or trends that can be insightful.
So listen, as we wrap up, Chantilly, even though you gave me the coronavirus, I want to thank you so much for joining us as our special guest.
Thanks so much for having me. I really hope that our viewers have a better understanding of contact tracing, and sorry for giving you the coronavirus, Alan.
Oh, well, you got to do what you got to do. Now, in the meantime, please feel free to share your comments below and include hashtag #BeDataBrilliant in your social post, or email us at hello@thedataliteracyproject.org. So listen, thanks everyone. Thank you, Kevin. Thank you, Chantilly. Stay safe, and we'll see you again soon.